Thank you.
Great. Thanks, Eric. So, Joe, thanks for your time today. I just wanted to start out with some questions to get a little bit of background for the folks on the call. And perhaps you could start by describing your role at Mercy Health.
So I'm the Chief Human Resource Officer for Mercy Health. I've been in the role about 6 years or so.
Okay, great. And prior to that, you were at Tenet Health. And what was your role there?
I was the VP of HR Operations, which is basically kind of the number 2 in HR there. Tenet, at that point, was about 75,000 employees, and we were right at the same number of hospitals, roughly.
Okay, great. And so, you know, given the topic of what we're talking about today, was it at Tenet that you became familiar with the talent science solution?
Yes, I'm an attorney, and I was getting my continuing legal education training, and the CLE presenter was an attorney who was presenting on the legal support for the justification of the validation of the, at that time, people answers, now talent science methodology. And it got me interested in the tool itself.
Okay, great. And so, so how many years have you been working with the tool now?
I was trying to figure that out. I'm pretty sure that I started with them a little over a decade ago, so 2008-ish, roughly.
Okay, great. And so across that sort of decade or so, what types of problems have you found yourself trying to solve, using the tool? And has it always been the same problems, or have you been sort of using it for different things along the way?
I think one perennial problem in the healthcare industry, which is turnover, especially nursing turnover for us. A second one is career pathing, which seems to be becoming more and more important as graduates come out with less and less clinical experience. And then a third one is kind of organizational transformation, taking an existing group of employees and trying to figure out if you can redeploy them in a different way or for a different purpose.
Interesting. So in terms of that turnover piece, were you using pre-hire assessments prior to using talent science?
Yes. In fact, we had about a 14 hospital pilot going with a different instrument, which I won't specifically name, and at the end of about a 6-month study period, was able to present to our CEO, Trevor Fetter, the results of kind of a 6-month study, which basically showed no difference in our turnover before and after. So he wasn't exactly impressed.
Makes sense. So, and I guess in your time since using the talent science solution, what kind of results have you been able to see from that? It was shortly after that presentation that I went to the CLE, and I thought, okay, well, this might potentially be a solution. So we began to walk down that path with talent science, people answers at the time, and we implemented first profiles in the nursing area, and we kind of let the data help us to figure out the modalities that were described earlier. Overall, between 2008 and 2011, when I was there, we had a 51% reduction in nursing turnover. So that's the difference in the recommended versus the not recommended rate. And just a fun anecdote, I was with a gathering of our CNOs, and one CNO stood up and pointed me out from the front, and she said, I was really upset when Joe told me we were going to have to implement the talent science tool. And she said, but I'm here to tell you he was right. the tool has worked to help us reduce turnover. And we've also implemented it here. So that was across a 28 state population. Here at Mercy Health, we implemented in 2012, and from 2012 to the present, we've seen similar results. I've had, in fact, I saw the post-deployment study just literally day before yesterday. We got it, and it showed a 58% reduction in turnover in emergency room nurses, and in about a 45% reduction in turnover in critical care nurses. And we did not have, unlike Tenet, we didn't actually have a turnover problem. So that's an improvement over, I think, even our existing state. So what it's really helping us do is find people who fit better from the beginning. And as anyone in the industry knows, ER critical care nurses are a rare gem when you find them, and landing those that fit and stay in their 0 to 5 year range is worth gold. So to have those kinds of results in those particular nursing modalities is just a real benefit to the organization.
That's great. Those are good outcomes. So you also mentioned using it for a couple of other initiatives like org redesign. Did you sort of experience similar or maybe positive results out of those activities as well?
Yes, I think probably one of the most striking examples of this is one of the things that we wanted to do was do a better job working with physicians that weren't necessarily employed with us, affiliated physicians who admitted cases to multiple hospitals, some to us, but also some to others. And we had a group of physician liaisons who were responsible for that. We put them through an assessment and really learned a lot about them and what they were like, and especially comparing their confidence level versus maybe a person who traditionally does more physician sales-oriented things, like someone out of the pharmaceutical industry, pharmaceutical sales or whatnot. And having learned that about our workforce, what we then did was we implemented a two-step process. One is we took those who profiled as high in relationships but low in confidence, and we assigned them to our loyalist physicians to maintain good relationships with them. And then we used the profile to do some really targeted hiring of those who were more sales-focused, who had higher confidence levels. And then we asked them to begin working with our physicians who were splitter physicians who admitted to us but also to other hospitals. And I can tell you from the incentive, we put in place an incentive scorecard to measure how effectively those, the new physician sales workforce was able to really recapture out-migration, and the results there were pretty impressive. So we ended up redeploying many of our existing workforce to loyalists, and still saw admissions go up from those who had been going elsewhere, just because we had people in place now who could explain to them what it was that we offered in terms of the ability to provide better service or better quality results in in the existing organization. So that was an exercise that we did right at the end of that I did in 2011 at Tenet, and it really helped us get the right people in the right place, doing the right thing. Even now for career pathing, when we talk with, one of the things that was interesting in my last post-deployment study, our recruiters have begun using the tool to actually do career guidance counseling even during the hiring process. As a nurse comes to us and tells us where she thinks she wants to work, we'll use the single assessment to bounce her against multiple modalities and offer her an opportunity in a place where she most fits with those high performers in our in our workforce. So she might think that she wants critical care, but she operates like a high-performing labor and delivery nurse, and very often they find that they have really come home. They come back to us 3-6 months later and say, these people are just like us. They're just like me. You know, they're amazing. And so so we use it a lot now for career pathing.
Great. Those sound like some good outcomes. So across the two organizations and the 10 years, if you were to summarize, what kind of keeps you using the talent science or people answers as product?
So a lot of the capabilities that have been implemented that were briefly mentioned earlier as moving it beyond an assessment tool, talent science really listened to what we asked for in terms of what was needed on their, and then baked those into their development path and began to roll them out. I think it was, they were doing big data before it was popular in the psychometric area, and that's another one that just continues to work with us, especially as we move from business intelligence to really advanced analytics. We have an entire deep database of psychometrics that are going to be very, very useful in helping us figure out how to deploy and redeploy our workforce in the middle of healthcare transformation. But capabilities like beginning to add the coaching model, the new manager feedback, which really gives the manager keys to how to manage a new employee once they arrive. The personal report that comes out, I've seen nurses sit around in a break room and use it like you would use Myers-Briggs to talk about what they're like and what their tendencies are, and to learn about one another. I think one of the slickest things is that the tool is developed in the assessment process is the way that it throws out recommended behavioral interview questions based on their lack of fit with the profile. So a manager can actually question most deeply the areas where the employee may struggle because they're not like your high performers. And then they can enter that back into the tool to see if the data that they learned in the interview process has mitigated that risk. So it makes the whole interview process much less subjective and much less prone to be derailed by a gut check. It makes it much more accurate, and hiring managers can participate in a validating way that gives them confidence. So those are a few of the things that I've seen grow in the instrument over the years that I think moves this way beyond just an assessment that tends to die in the new hire file.
Right, interesting. So in conclusion, and this has been great insight, Joe, appreciate it. Is there anything else that you'd like to share from your experience in partnering with the talent science team?
Not that particularly comes to mind. I think that although I was one of the things I was inventorying just mentally as you went through the great list of organizational trends, I think most of which are hitting us pretty squarely, whether it's the differentiated employee experience. The tool has the ability to help you dial in fit. Even in performance management, being able to go back and figure out how that employee is hardwired and what their derailers are, to figure out if that's a factor in performance as you move to that agile check-in process. I talked about the organization of the future. I think we're going to do a whole lot more workforce redeployment, moving people from inpatient centers to ambulatory care centers, all kinds of organizational transformations. And I think figuring out what our talent is capable of, rather than the traditional restructuring, which sometimes can throw out the baby with the bathwater. I think the tool holds a lot of abilities for us to meet a lot of the coming trends that you so ably, I think, walked us through at the beginning of the conversation. So for me, it was confirming when I looked at the challenges ahead personally and said, okay, good. I've got components of the talent science tool that can really help me meet a lot of these. Even the career ladders and learning piece, I think, helping people start to figure out where they go next from here, and what they can do with that, and understanding more about themselves. We talk about, in Mercy Health, we talk about helping people find their calling, and really seeing how they're made is a part of helping them find their calling, and people then are more engaged and happier. They're connected to something larger than themselves, and they're doing what it is that they were meant to do. And for us, that's what it is to get them, to get somebody in that place doing that. Then you've got a formula for both engagement and for retention over the long haul.
That's great. Perfect. So thanks very much, Joe. I'm going to turn it back over to Eric.
Yes, I'm here.
See if there's...
Before you go, Joe, there were a few questions that you can probably help us answer. One of the questions is related to, you started by talking about the fact that you have legal training, and that you became aware of this, I think it was in CLE training, is that what you said? So this is ongoing training that you have to keep your law degree, right?
That's right.
And the question is with regards to the legality of using this kind of a tool. Is there any fear of being sued for using this kind of a tool?
Well, as one of my old law professors used to say, people can sue you for coffee grounds. So now whether or not it's valid and will stand the test over time is the question, right? The validity that's dialed in, especially at both the job content level and at the specific, when you customize the profiles, it basically gets to your workforce on a set of behavioral criteria that's completely, that is based on their performance feedback. So the science behind the validation methodology is absolutely sound from a validity perspective. And I've not struggled with a non-discriminatory impact either in it. In other words, it's screening out candidates. We're working fairly actively to diversify the workforce. In fact, we're hiring right now Ohio is about 9% of the nurses in Ohio are minorities, and we're hiring right now at about a 13% rate. And we're using the talent science tool. So I can tell you it's not having a non-discriminatory impact, although we've got the validity studies to back it because talent science does it for us.
Very good. So the second question we have is along the lines of the attendee thought that this was really just an assessment solution, but you talk more about the service and the software components of it. Is it more than just results from an assessment, or are they being used in other places? So, and I think you talked a little bit about you're using it in recruiting, you're using it in coaching, you're using it in performance. Is that correct?
Yes. In coaching, this is a tool that's made for really mass self-deployment. It fits in that space where you want to provide coaching, but you just can't because it's financially impractical. So yes, our managers are able to reach the coaching model, set up development plans in there for employees. They're able to use the feedback. I forget the name of the manager new hire report that they get sent to them within the employee's first 90 days that tell them what motivates the employee, what derails the employee. It's really about so that they can tailor their supervisory style to that employee. So this thing lives well beyond we're even now using it to begin to insource. Like we've got a set of recruiters that are going into the profiles and are mining for tomorrow's. People have taken a single assessment and they're mining our LPNs to figure out which of those LPNs should be tomorrow's RNs based on best practice profiles. And then they're calling and inviting them to participate in our tuition reimbursement program and to to take the next step in their career. I mean, how cool is that? How many times in your career has somebody called you and said, "Hey, I think you ought to
sign up for tuition reimbursement. Well, we've pre-qualified you. Why don't you get going on a step that could lead to promotion and significant, financial step up for you personally. So
that was exactly 0 times. So
yeah.
That leads me into the next question. Do you mandate that your recruiters use talent science?
Well, yes, my recruiters. Not, we don't mandate that we don't have a cutoff score. We don't mandate that hiring managers, so we allow hiring managers to have the difficult lesson learned of hiring a not recommended, and they may actually know the employee. There's some reasons why I've never mandated a cutoff score. I haven't needed to, though. When you begin to do the root cause analysis for why employees left, and you show that back to the hiring manager, they come into line pretty quickly on following the recommended guideline, unless they have a very good, valid, specific reason to bucket, and that fixes really the compliance issue. But for recruiters, it's a little bit of a no-brainer. When a recruiter sees that a recommended is going to stay, in our case, the recommended stayed two to three times as long as the not assessed even. So the recruiter's just making work for themselves by not doing it. It's not really hard to get compliance, but we do require recruiters to do it.
Yeah, awesome. And then the final question we had for you was just with regard to post-deployment studies. There was a question about does every profile have a post-deployment study, and what are those post-deployment studies like?
So the post-deployment studies, they do look at every single profile, and they'll do it on whatever outcome data that we can reasonably provide to them that you can correlate to it. We did this first one. We did the one at Tenet. We did the first one here on turnover, but in our conversation, we actually talked about staging a whole set of other criteria, and I've done with them correlation studies related to HCAHPS and clinical outcomes and several other things as well in the post-deployment studies. So the behavioral science team is pretty capable, and as long as you can provide them the data, they can do a lot with your data to really help you tune it into where you want it to be.
Okay, good. And this last question is for Dr. Boatman. So, Paul, the question is, how many profiles does the typical hospital see? And this is referring to the custom performance profiles, of course.
Sure, that's a good question, and a lot of that is dictated by the expansion.
Oops, we lost you there, Paul. We might have to follow up with that attendee about that question. I can provide a little bit of color around that myself. In the numerous healthcare facilities that we've done, we're typically seeing anywhere in the range from about 10 to as many as 30 custom performance profiles, and most of those are deployed in the nursing ranks because, as Paul had mentioned during his presentation, that different modalities see different components of success and different reasons why a nurse would be successful. And so, like I had mentioned, we're seeing anywhere in the neighborhood of about 10 to about 30. The way that Infor produces the modeling for this, there's really not that big of difference in the cost between a small deployment of profiles and a large deployment of profiles. So, we're usually providing enough so that they can exhaust them, and they're not coming back to us and trying to deploy more a couple of years later. So, which brings us to the end of our questions, and as I look at the time, to the end of our presentation. We appreciate the fact that you were able to attend today. I am going to be sending out the recorded version of this webinar to you and to those who registered but were unable to attend. And certainly with that will also be a connection directly to the account executive who is responsible for your business here at Infor. And I would anticipate that you'll probably be getting a reach from one of those account executives just to make sure that we've answered all of your questions. And certainly, if you are interested in seeing more and getting a demo of the software, since we've run out of time to do that today, would ask that you reach out to us and we can do a simple demo of the software and certainly answer any questions that you might have. So thank you for attending. We really appreciate it. And we come to the top of the hour. It is now 2 o'clock Eastern Time. Thank you so much, and we'll be talking shortly. Thank you. Bye.